This is a patient with long-standing pain and scoliosis that has been getting worse over the years. Patient has significant claudication and scoliosis, as you see. This patient actually in the CT shows that has a lateral listhesis, a scoliosis that in a down position is 30, but in the up position is up to 45 as well. And you see as well degenerative disc disease in multiple levels. We decided on a 4-level scoliosis correction with anatomic decompression, L1 to 5. We do these procedures often with segmental correction, and we usually fix the levels that are symptomatic. So we decided not to address L5S1. Here, over the years, we have had very good success with that. The data are being gathered and published. In this case, here is pre-op and post-op finding in the surgery, and here I'm going to now show the pictures of the surgery. We are aligning first our X-rays, and here you see that the first Jamshidi is placed and the K-wire placed around 9:05. Then we perform the OLLIF, transcabinet OLLIF for the lowest level. Here, as you see, we enter it, dilate, and as you see the scoliosis, I decide to put the cage all the way to the right side. And here you see the position of the cage. The tip of the cage is looking outside of the confine of the vertebral body. This is something we do often to correct as well for the lordosis. So and generally it's not a problem. In this patient, later on, patient had a severe fall and that became a problem. But for now, this is by itself a positioning that corrects the scoliosis and restore the lordosis to some good degree. Here we then go ahead and put the K-wires in the 4. We then do the transcabinet OLLIF for the 3-4 level. And by this time, surgery was started 9:05. By 25 minutes later, almost the second cage is already placed. And here again, we put the cage to the right side to correct for scoliosis. Then we move on to the next level, put the K-wires in place, and then approach the 2-3 disc in the same fashion. As you see here, the bending is mostly to the left side, and we here perform a discectomy and then put the cage here to the left side, again to correct the scoliosis. And then we address the L1-2 level with same fashion transcabinet OLLIF. And as well here in this level we put a cage on the left side to correct the scoliosis. And as you see here, if you look here, when the cage is entered, to a certain degree, which we show to be 5 to 7 degree scoliosis can be corrected. At this point, obviously, we go ahead and finish the posterolateral instrumentation. This is a device we call decorticator. It goes eccentrically over K-wire, grind the surface of the facet, and then we are able to put biologic in and achieve posterolateral fusion. Screws are going in. Rod is bent to the proper shape, and as you see, the rods are placed, and this is our final picture of this patient. And as you see, 10:51, meaning about 1 hour and 45 minutes after the cut, surgery is done.